Again, this is Dr. Eduardo Lopez. Now we're going to be talking about finishing encounters with patients. I would say that this is probably one of the most important components of the patient-physician interaction. We're in Encino. I want you guys to realize how many cardiologists we have in Ventura Boulevard. It's probably 10, 20, 30. You've realized the kind of patients that we have. VIP people. Very important patients. Not to say that every patient is not important, but I'm talking about people that they have the ability to go to wherever they want. And they will come wherever they feel comfortable at. So that's what I want to get my point across. We need to treat people as if you were treating your mother. And this is an important point of the practice. So finishing encounter is it's something that is basically requires a lot of personal touch. When you're talking to the patient, you just not say, oh, by the way, do you have any friends to refer? No, you need to get into a personal conversation with the patient, and you need to sell your points across. The incidents are there. I'm sure everybody has heard about how many people die of heart disease in the United States, but they just don't get the point across. And I want you guys to think about this before you go and you talk to the patient. So like 3 or 4 years ago, and by the way, we're in the year 2007, we used to get our referrals from other internal medicine doctors, other cardiologists. A lot of people were referring to us. These days we know that basically the practice is growing, and it's based on a patient-to-patient referral, what we call word of mouth. And why? Because I really believe that we're the best. I really believe that we provide the best possible care. I always tell my patients that if my family were here, Dr. Ben-Zur would be the cardiologist, the treating cardiologist for every person that I know or every person that I love. And I want you guys to feel it. I want you guys to realize that and to be convinced that this is the best way to practice medicine. Because really, if you think about it, how many doctors are available to their patients when they need them? Very few. How many doctors give their pager numbers to their patients? I don't think there are many. How many patients work on Sunday? How many doctors work on Sundays? I don't think that many. You need to get those points across when you're interacting with the patient, when you're finishing the encounter. And the most important thing is that we want those patients to bring more people to the practice. And this is how I normally do it. Basically, at the end of the interaction, I have some instructions. I like always to write down the instructions in the little discharge sheet protocol that I wrote in one of my papers, and I want you guys to go over that. Basically, if you give the patient the written instructions, they're going to be happier. They're going to understand more where we're going, and it's going to be easier for documentation purposes. When the time comes, I want you guys to please sit down and engage into a conversation with the patient. It's a totally different story if I tell the patient, hey, here, can you please bring your friends and family? They're going to do this. They're going to walk out of the office and they're going to throw it away. So that's not the purpose of the interaction. The purpose of the interaction is get your points across. So in order to do that, you need to get into a personal level with the patient. I always try to create awareness of the impact of heart disease in the American society. As I said at the beginning, I think most people understand that heart disease is the biggest killer, but they don't really realize the magnitude of this problem. So I came up with several strategies. One of them was creating we call that the F-square sheet, which basically means the friends and family sheet. It's the purple sheet. Basically, we have some facts that numbers of heart disease in the U.S., 25 million people have heart disease in the United States, and about 1 million have heart attacks every year. Heart disease continues to be the biggest killer by far. Even if you put all the cancer numbers together, they won't even equal the impact of heart disease in our society. I want to tell the good things about the practice, the fact that Dr. Ben-Zur is extremely experienced, that he's triple board certified in internal medicine, cardiology, and electrophysiology, that he was trained by experts in the field, that Dr. Ben-Zur was a former assistant professor at Albert Einstein College of Medicine in New York, that Dr. Ben-Zur is a physician with more than 20 years experience in treating cardiology, cardiovascular diseases, and basically that we have EMR. You probably don't realize how important it is, but when we have EMR, basically we're under control. I cannot stress out enough the importance of getting this point across when you're talking to the patients. EMR is an extremely important tool that very few practitioners, very few private practitioners have implemented yet. Maybe you're going to make fun of me in 10 years, but we're talking about 2007, and very few doctors have these videos. Very few doctors have the EMR available at this moment. So you need to tell them about this. I like this. I created this slide, this PowerPoint slide, and I try to create, because I think it's pretty shocking when you think about these numbers. We have 3 dates here that are pretty memorable in the American history, and the point is that over 3,000 people died, over 3,000 Americans died these days for these horrible events that we all know took place in these dates. But the important thing is that more than 3,000 Americans die every day from heart disease. Every 30 seconds an American dies from heart disease. And about 25 million people have heart disease in the United States. So I need you to get the patients informed and educated about this reality. So when you get into a personal touch with the patient, you can say, hey, listen, you may be saving someone's life. That's a reality. Your friends, your family, your wife, your husband, your uncle, grandmother, everybody has people that, if you think about it, everybody requires a cardiologist. So another strategy that I use to approach the patient is that, and they understand this very well when you tell them this concept. You go to your GI doctor to get a colonoscopy when you turn 50. You go to your OBGYN doctor to get your pap smears, your mammograms, and on a yearly basis. You go to your urologist to get your prostate checkup. But very few people go to your cardiologist or go to a cardiologist to get checked. Heart disease is the biggest killer, but it's preventable. And that's where you have to sell your point across. You need to have the patient understand that by doing routine examinations like exercise, stress tests, echoes, cardiology visits, we're able to diagnose and treat. And I cannot tell you how many times it happened in the office that people were walking, bombs. We picked it up. They had silent coronary disease. Otherwise, they would have had a heart attack or something bad really happening. You can also use commonly known examples like President Clinton. I don't know if you guys remember, years ago, President Clinton ended up having a quadruple bypass. Who would have thought the most powerful man in the world was developing heart disease? Very, very hard to believe, but he had it. Anybody can have it. So I want you guys to also sell that point. The point is that not everybody with heart disease have symptoms, and most of the time it's a silent killer. You don't feel anything until you had an incident. And I want to tell you also that statistics shown that only 50% of the people who have a heart attack make it to the hospital. So we're talking about a significant catastrophic, disease, heart disease. So at the end, you always have to make the patient feel very comfortable. You always want to ask him, do you have any questions? Is there anything I can do for you? Do you need any professional samples? Do you need any prescriptions? Do you need to talk to the doctor? Is there any other questions that were unanswered during the encounter? And we're probably talking about 10 minutes with the patient when we're finishing the encounters. We have our welcoming videos, we have our website, we have many things. Some of our patients are okay with us sharing their personal story and their personal testimonials, like Michael Moline, like Robin Levy with the husband. I hate to use those names, but that's the reality. That's the face of heart disease, seeing a 39-year-old man dropping dead in Ventura Boulevard. And that's the reality of heart disease. And the widow is okay with us telling that to the other patients because she absolutely doesn't want anyone that has to go through the same pain that she's going through. Same thing with Michael Moline, a young guy, never had a problem, out of the blue, had a massive heart attack, survived. Now the guy is in perfect shape, but just to illustrate the impact of heart disease. So again, one more time, when you're finishing with the patient, take your time. Don't rush it. Get into a personal level, get your points across, get into the patient's brain. It's extremely important that you get this point. Otherwise, they're going to get rid of the material, and that's it. I also, when I'm finishing with patients, most patients have this. However, new patients don't have the brochure. So at the end of the encounter, provide the patient with a copy of the brochure. You know, it has a lot of nice information about Dr. Ben-Zur's background, has a lot of nice information about some patients' testimonials, a lot about, you know, the services that we provide in the office, and what other doctor says about Dr. Ben-Zur. So talk to the patient, take your time. I also give them a card, business card, and I normally write down the doctor's pager number in the back of the card. You know, people really appreciate when they're able to reach the doctor if they're having symptoms. You can always tell the patient, have you ever been in an emergency room in the United States? They're going to tell you, yes, it's the most horrible experience, because I don't think you will get away with 3 or 4 or 5, 6 hours wait before you go home, and they tell you, no, you're okay, maybe this is not your heart. You know, having a cardiologist to respond at any time, 2 in the morning, 3 in the morning, weekends, holidays, not going to vacation, I mean, that represents a lot. And I do believe that from the bottom of my heart that this is the best cardiac care that people can get, but I need you guys to feel it and to really believe it. When you believe things, you have the power to convince people. If you don't believe things, you're probably just going to tell things and people is going to get annoyed and they're going to just waiting for the moment that you let them go home. So realize that. It's very important for the practice and it's very important for you. You know, you're going to make your job more enjoyable if you feel it, if you get into a personal level with people, you have friends forever. And I need you to realize that finishing the encounter is an extremely important part of the interview. So thank you so much.